Good morning, everyone, and welcome. I'm Dr. S.K. Singh, holding a PhD, and I am excited to have you here today. We will be discussing corrective action and preventive action, commonly known as CAPA. In this presentation, we'll explore what CAPA is, why it's important, and how it can help us improve our processes. We'll look at the key steps involved and some practical examples to make it clear. So let's get started and dive into this important topic together. The purpose of the CAPA system is really centered around identifying, investigating, and eliminating nonconformities that we encounter in our processes or products. It's about making sure we address issues thoroughly so they don't just happen again. We do this not only to correct problems, but also to prevent their recurrence through effective corrective actions, and to prevent potential issues before they even occur with preventive measures. This system plays a crucial role in the continuous improvement of our quality management system, helping us to stay ahead and enhance our overall quality standards. Additionally, compliance is key. By following CGMP and regulatory requirements, we ensure that our practices meet industry standards and legal obligations. And ultimately, all of these efforts are about strengthening product quality and, most importantly, patient safety. Because at the end of the day, our goal is to deliver safe, effective products that meet the highest quality expectations. So, the CAPA system is really a vital tool in achieving those overarching objectives. Sources of CAPA, or corrective and preventive actions, can come from a variety of origins. One major source is deviations and nonconformances, which are unexpected issues or failures that don't meet our set standards. Out of specification, or OOS, and out of trend, or OOT, are also key indicators. These happen when test results fall outside the expected range or show unusual patterns. Customer and market complaints are important signals too, as they reflect real-world issues that need addressing. Audit findings, whether internal, external, or regulatory, often uncover areas for improvement that require CAPA. Change control system issues can also trigger CAPA actions, especially when changes impact quality or compliance. Equipment and utility failures are another critical source, since equipment downtime or malfunctions can compromise product quality. Environmental monitoring trends help us identify shifts or increases in environmental contaminants that could affect our processes. Process performance and quality trends reveal ongoing issues or declines that need correction. Lastly, supplier and vendor issues, problems with raw materials or components, can directly impact our product quality and demand CAPA intervention. Overall, understanding these sources helps us proactively identify and address issues to maintain high standards across all facets of our operations. Let's take a closer look at the CAPA workflow, or corrective and preventive action process, to understand how it helps us improve quality and compliance. It all starts with the identification of the problem. That's where we recognize an issue that needs attention. Next, we move on to the initial containment action, which is about immediately limiting the impact of the problem to prevent it from spreading or causing further issues. Once we've contained the problem, we conduct a root cause investigation to determine the underlying reason why the issue occurred. Following that, a risk assessment is performed to evaluate the potential impact and prioritize our corrective actions accordingly. Then, we implement corrective and/or preventive actions to address the root cause and prevent recurrence. It's essential to document every step of this process thoroughly to maintain traceability and accountability. After implementation, we verify the effectiveness of these actions, often through an evaluation of the effectiveness, or EVA, to ensure that the issue has truly been resolved and won't happen again. Finally, we close out the CAPA and look at trending data to identify any patterns or recurring issues that might require further attention. This workflow is a continuous cycle, helping us refine our processes and maintain high standards across the board, tying back to our overall goal of continuous improvement. When conducting an investigation, it's essential to use structured tools to identify the root cause effectively. Some of the most common tools include the 5 why analysis, which helps us drill down by asking why multiple times. The fishbone diagram, also known as the Ishikawa diagram, which visually maps out potential causes across different categories. Fault tree analysis, or FTA, which is a logical, deductive approach to trace the pathways leading to the problem. And is not analysis, which helps us clarify what the issue is and what it is not, narrowing our focus. It's important that our investigation remains evidence-based and data-driven. That means relying on facts and solid data rather than assumptions. We also need to document everything thoroughly, so we have a clear record of our findings and reasoning. And of course, the entire process should be completed within a defined timeline to ensure timely resolution. One of the most crucial points to remember is that we need to identify the true root cause, not just the symptoms. Sometimes, what appears to be the problem is actually just a surface issue. Digging deeper allows us to address the underlying cause, which ultimately leads to more effective solutions and prevents recurrence. So, in summary, our goal with investigation and root cause analysis is to be systematic, precise, and focused. This way, we can uncover the real issues and resolve them effectively, supporting the overall goal of improving quality and safety. Now let's talk about corrective action, or CA, which is all about eliminating the root cause of an issue. The goal here is to address the underlying problem, not just the surface symptoms. Some common examples include revising procedures or updating standard operating procedures, often to clarify or improve processes. Training or retraining staff is another essential step when gaps in knowledge are identified. Sometimes, equipment needs repair, calibration, or requalification to ensure it's functioning correctly and doesn't contribute to the issue. Adjusting process parameters can also be necessary to optimize performance and prevent recurrence. In cases where suppliers are involved, requalification or even changing suppliers might be required to ensure quality. If applicable, batch segregation, recalls, or rework can help prevent faulty products from reaching customers. And finally, strengthening data integrity controls is critical to ensure accurate and reliable data, which supports ongoing quality and compliance. A key rule to remember is that corrective actions must be practical, justified, and timely. They should be realistic to implement, backed by solid reasoning, and executed promptly to be effective. All these points connect back to our overall goal: continuous improvement and ensuring the highest quality standards. Let's talk about preventive action, or PA, which is all about stopping potential issues before they even happen. The idea is to be proactive rather than reactive. For example, we might implement new controls or automation to reduce risks. Or, we could revise training programs to ensure everyone is up to date on best practices. Trend analysis and preventive maintenance are also key. They help us identify patterns and address them early. Increasing the frequency of environmental monitoring is another way to catch issues sooner. Improving supplier quality programs ensures that the raw materials or components meet our standards from the start. And revising risk assessments, like FMEA or QRM tools, helps us better understand and mitigate potential problems before they occur. It's important to remember that regulatory expectations emphasize that these preventive actions need to be evidence-based. That means they should be directly linked to risk signals or trends we've identified. This connection ensures that our proactive measures are targeted and effective, ultimately supporting the overall goal of quality and safety in our processes. Now, let's talk about evaluating severity, occurrence, and detectability. These are key factors in assessing risk effectively. To do this, we often use tools like FMEA, the risk matrix, and hazard analysis. Each of these helps us identify where the biggest risks lie and how serious they are. Once we've assessed these aspects, we can prioritize CAPA actions accordingly. High risks require immediate corrective or preventive actions, so we jump right into those. Medium risks are addressed with targeted improvements, and low risks are monitored over time. It's crucial that our risk assessments are well documented and justified, so there's a clear rationale behind every decision. This approach aligns with ICH Q9 guidelines, ensuring our risk management is thorough and consistent throughout the CAPA process. Now, let's talk about what a CAPA record must include to be effective. First, it needs to document the corrective and preventive actions taken to address the problem. This is crucial because it shows how we're not just fixing the issue, but also preventing it from happening again. Next, we need to specify the timelines for these actions and identify the responsible persons, ensuring accountability and clear deadlines. If training was involved in implementing the CAPA, those records should be included too, because training often plays a key role in preventing recurrence. We also require an effectiveness check plan, which helps us verify that our actions actually work in resolving the problem. Once everything is in place, final approval by QA is essential before closing the CAPA. This step confirms that quality assurance has reviewed and approved the actions taken. Now, moving on to the documentation and tracking aspects. It's important to document the source of the CAPA, the problem statement, and the investigation details along with any evidence collected. Conducting a root cause analysis helps us understand the underlying issue, and performing a risk assessment allows us to evaluate the potential impact and prioritize actions accordingly. All these elements together create a comprehensive CAPA record, which not only addresses the immediate problem, but also supports ongoing quality improvement and compliance. Remember, thorough documentation and tracking are key to maintaining a robust quality management system. After we've implemented the CAPA, it's essential to verify that the actions we took actually addressed the root cause. This step helps us confirm that the problem won't recur. To do this effectively, we need to look at measurable criteria such as ensuring there are no repeat deviations, that trend patterns have stabilized, and that overall compliance has improved. These indicators give us confidence that our corrective actions are working. Performing follow-up audits is a key part of this process. They allow us to review data and trends over time, making sure the improvements are sustained. Additionally, ongoing performance monitoring helps us catch any early signs of potential issues before they become bigger problems. It's also very important to document the results of the effectiveness verification, or EVA, before we close out the CAPA. This documentation provides a clear record that we have validated the effectiveness of our actions. Remember, EVA is our final check to ensure that the root cause has truly been eliminated and that the process is under control moving forward. Let's go over some key takeaways to wrap up our discussion. First, CAPA, or corrective and preventive action, is not just a good practice, it's a mandatory regulatory requirement. This means we need to approach it with the seriousness it deserves. It's important that our CAPA processes are well-structured, risk-based, and backed by scientific justification. This ensures that we're addressing the real issues effectively and efficiently. Having strong CAPA systems in place helps prevent the recurrence of problems and also contributes to building a stronger quality culture within the organization. It's about creating an environment where quality is prioritized and continuously improved. Root cause analysis is a critical part of this process. It must be accurate and evidence-driven, meaning we rely on facts and data to identify the true source of issues rather than assumptions. When we implement effective CAPA measures, we not only stay compliant but also promote consistency and, most importantly, enhance patient safety. Ultimately, these efforts support our goal of delivering safe, reliable products and services. Let's take a moment to look at some key regulatory references that guide our CAPA processes. In the United States, the FDA's 21 CFR 211.22, 211.1, and 211.192 set clear requirements for investigations and CAPA systems. These regulations emphasize that any deviation or issue must be thoroughly investigated, and appropriate corrective and preventive actions need to be implemented. Moving to Europe, the EU GMP Chapter 1 and 8 focus on establishing a solid quality system, managing deviations effectively, and ensuring CAPA are properly handled to maintain compliance and product quality. Internationally, the ICH-Q9 guideline underscores the importance of risk-based approaches to quality management, encouraging us to prioritize our efforts based on the potential impact. ICH-Q10 further expands on the pharmaceutical quality system, providing a comprehensive framework that integrates CAPA into the broader quality management system. The WHO GMP guidelines also emphasize that CAPA should be both corrective and preventive, aligning with global best practices. Now, the most critical point across all these references is that CAPA must be data-driven. This means decisions should be based on solid evidence, not assumptions. It should also be risk-based, prioritizing actions according to the severity and likelihood of issues. Documentation is essential. Every step, investigation, and decision needs to be thoroughly recorded. And finally, verification is key. Before closing out a CAPA, we need to confirm that the actions taken effectively address the root cause and prevent recurrence. Connecting this to our overall theme, these principles ensure our CAPA system is robust, compliant, and effective in maintaining high-quality standards. It's about building a culture of continuous improvement grounded in data, risk management, and accountability. For further support, please feel free to reach out to us. We're here to help with any questions or additional information you might need. Thank you so much for your time and attention throughout this presentation. We appreciate your interest and look forward to assisting you moving forward.